To treat leukemia and other blood cancers might soon be a new ray of hope to millions of cancer patients with solid tumors. Researchers at Stanford University recently presented their latest results of trials involving CAR-T, a type of immunotherapy. Here to talk about that is our 9 Health expert, Dr. Payal Kohli. Good morning.
Hi, good morning.
So let's talk about immunotherapy. Can you explain that?
Yeah, so immunotherapy differs from traditional chemotherapy. So chemotherapy basically means chemicals that go through the entire body, poison, that kills any dividing cells. And you can imagine that would kill cells in your hair, in your stomach, causing a lot of the side effects like hair loss and problems with our mouth and our diarrhea and some of the things we see with cancer therapy. So the idea of immunotherapy is using more targeted therapy, using either specific markers on the cell surface to figure out which cells to target the therapy to, or using the immune system to actually try to identify those cancer cells and just kill those selectively.
I mean, just hearing you say this is a total game changer, because when I went through treatment, it was the symptoms that were just horrendous, the hair loss and everything. And I always remembered asking my doctor, why can't you just target the tumor? Why do you have to
kill everything?
Kill everything. The hair, like, why does the hair have to go and everything like that?
So true.
So talk about CAR-T and how does it work in the fight against blood cancers?
Very, very exciting development. We've been using it in liquid tumors for a while. So CAR-T basically means taking the patient's T cells and genetically engineering them to express and to sort of recognize cancer tumor markers, putting them back into the patient where they then divide, and they're the soldiers that then go out and identify those specific cancer cells only and target those. So using the patient's own immune system, genetically engineering it to really identify that cancer and attack it.
And when the immune system is the one that's kind of harnessed all those problems to begin with too. Talk about the challenges and any side effects to this therapy.
So, even though it's very targeted, we're hoping it has less side effects. Anytime you activate the immune system, especially in such a global fashion, you can get something called cytokine storm, which basically means that the immune system goes to full-blown war. So if you infuse a bunch of T cells back into a patient, it could release these cytokines or chemicals that really non-selectively activate the immune system and create many of the side effects that we can sometimes get, when we get fluid in the lungs, we get lots of immune system attacking itself, many of those types of problems.
This is very exciting for anyone watching. Where are we at in terms of trial? Or is this very preliminary at this moment?
No, in fact, for liquid tumors, it's very well established as a therapy now. Now, the application to solid tumors like breast cancer, lung cancer, that's a little bit more of a scientific challenge, because many of these tumors, for example, display different types of antigens or proteins from one person to the next. So designing the T cells to basically recognize those can be a little bit more of a challenge. These solid tumors also sometimes have a microenvironment, which means around the tumor they release chemicals that fight off the immune system, basically. So it's a little easier with liquid cancers, which are kind of all over the body, as opposed to one specific tumor. But that's the new application that we're all really excited about.
Wow, this is very breakthrough. Dr. Kohli, thanks so much.